1 out of every 4 children have deficiencies. Children who are deficient in vitamin D may have calcium deficiency, may not even gain their full height. I totally believe in annual health checks in children. Children doesn't have to come to a clinic only when they are sick. Sugar is always been given as a treat. First we get our kids to get hooked onto it, and then we struggle later to take it out because that's what they crave, but they don't have any idea what they've been given. We as parents are giving it to them, we offering it to them, saying that it's just a child and let them have some chocolates and let them have some ice cream. It's okay, it's a child, but well, it's not a good path to take. The child has an association.
Hi guys, I'm Dhruv Gupta, co-founder of Orange Health Labs, and welcome to the Orange Club podcast. Here we'll be bringing on doctors and health experts to talk about all things that help all of us live healthier and better. Hi, today we have Dr. Gurmeet Soni Bhalla with us. Dr. Gurmeet Bhalla is a seasoned allergist and a pediatrician with over 25 years of experience across Fortis, Rainbow, and RxDX. Besides her medical expertise, she is also a very inspiring runner. She's done marathons across all 7 continents from Machu Picchu to Antarctica. Very excited to have Dr. Gurmeet Bhalla here. Welcome, doctor. At what point should you start worrying about deficiencies, vitamin or mineral deficiencies in your children? What should you be testing for? What is good practice from your perspective? We're all parents and we all worry about our children's health, but few of us know what to do.
I know that's a good question, and then most of the times parents are not aware of what to look for as well. So, firstly, I would say that till about the age of 5, or even let's say till about the age of 2, you would go to your doctor and your pediatrician literally very often, few months, and then it becomes maybe once a year. So keep those annual visits going because they will help you figure out if your child has any deficiencies. I totally believe in annual health checks in children. The children doesn't have to come to a clinic only when they are sick, because then we're just doing a band-aid approach. We're just making sure they get better and then they go on, and the rest is left to whatever's happening. So they never get picked up for deficiencies. In my practice, I've seen kids have vitamin D, vitamin B12, iron deficiencies in major. 1 out of every 4 children have deficiencies. So they can only be picked up if you did regular routine visits. A blood check, I do blood checks annually for every pediatric child after 10 years of age to make sure that we pick up on these deficiencies and then supplement so that they get optimal health, because this is a growing phase and this is where the growth trajectory and the puberty is hitting them. So they need to, besides getting good meal, nutritious meal, if there is any deficiency, supplementation should be done, because then we are giving them a fantastic platform to start with. Children who are deficient in vitamin D may have calcium deficiency, may not even gain their full height. So because we are living in a time where this is possible, we should take advantage of that and definitely get ourselves and the kids tested early.
Got it. No, I think that makes a lot of sense, right? And the other part that we worry about as parents is nutrition, right? Many parts to this actually. One, of course, is sugar, which we can touch upon. But one of the things that a lot of parents today are keen on their kids playing sports more actively. A lot of like soccer coaching and sports coaching, and schools have also taken it up more seriously, right? What's age appropriate what should a nutrition guideline look like for kids? Protein, carbohydrates, how should they be thinking about nutrition?
Every age of a child has actually different recommendations. So there's a different recommendations for very little babies, and then going on till about 5, there are different recommendations for carbohydrates, proteins, and fats. And as they grow older, when they grow into their puberty and things like that, so the recommendations given, the guidelines which are given by the Indian Academy of Pediatrics, very clearly gives different values, different kind of proteins or different values for the age groups. For example, for a child under 5 years of age, you may have 1 gram per kg body weight as a protein requirement, but that requirement can become 1.5 to 2 grams per kg body weight if the child is an adolescent and is an athlete. So the recommendations which are given by the pediatric body very clearly tells us how much of carbohydrates, proteins, and fats, minerals, and vitamins, and water as a hydration should go in. So every age has a different criteria.
Got it. No, that makes sense. And sugar is a hot topic always for adults and for kids. I know at my household there's a lot of uh, debate over like consuming less sugar. Um, what's your recommendation to parents, about how they should think about and modulate, not
I
just think
know.
about, but how do you modulate sugar
I'm
consumption?
kind of I'm a very strict pediatrician as far as that is concerned. Sorry, but I feel that sugar is always been given as a treat, and then the foundations get laid that sugar is a treat from a very early age of a child. I really wish that that would change, and that is not done so. Like, you don't have to give candies as treats because that sets in the thing that it's a good thing. It's not a good thing. We all know that. First, we get our kids to get hooked onto it, and then we struggle later to take it out because that's what they crave. But they don't have any idea what they've been given, because we as parents are giving it to them, we offering it to them, right? So as far as possible, sugary treats should be limited. And if you ask me, if I'm get very generous and say, okay, yes, you can have it, I would say make sure the meal time is not shaken. The meals are given as a regular meal, and maybe you could offer a small little piece or a square of chocolate at the end of it. That is all right. But large doses of sugars actually suppress the satiety center, and then it crashes, and then they get into all kind of temper tantrums as well. And yeah, it is again inflammatory. We don't want sugar to be given to children. I would say that use natural sugars. Now, when I say natural sugars, are not like people say jaggery is a natural sugar. That is a sugar nonetheless. There are fruits which have sugars. We have berries which have sugars, right? So dates which have sugars. So we could work around that if we could, and then keep synthetic sugar as less as possible. But I guess every household is different, so you have to fight your own battles. So a little bit of giving in is all right, but I think every parent should keep a check on the sugar, because you're actually laying a foundation for a healthy adult. So if we mess it up now, then they get messed up later as well.
Yeah, no, absolutely. It's a mental pattern. I think that point you made is very pertinent about the fact that we have this correlation or positive association between celebration and sugar.
Absolutely.
Treats basically.
Or junk food and treat. Every
Absolutely.
birthday is a McDonald's or a Dunkin' Donut thing. I mean, it's a kind of celebration. We've not celebrated vegetables ever. We've never had, right? It's so boring, isn't it? So that's how the associations are created when they're very young. And I have seen over a period of time, whatever you eat as a child and which you enjoyed, you will gravitate towards it when you're an adult.
True.
So saying that it's just a child and let them have some chocolates and let them have some ice cream. Oh my God! And I've had people who even give laddus with rotis to eat because the child is not eating. It's okay, it's a child, but well, it's not a good path to take. The
Yeah.
child has an association. Yeah.
So, besides nutrition and some of these mineral and vitamin deficiencies, any other sort of health uh, concerns that go unnoticed by parents? That there are things for parents to like keep in mind, common health issues among kids, which are, you know, it, could be like one of my kids complains a lot about like tummy aches and headaches and things like that, and sometimes I don't know whether that's just an excuse or whether that's a real thing.
Yeah. So again, I think I personally feel that if it is not just an excuse, then the body is actually talking to you and telling you something is off. You would have heard of a lot of kids who say, "My legs hurt," and then we always thought it was growing pains, until of course we started testing and checking there was vitamin D deficiencies. They were not just growing pains. The children were really deficient in vitamin D, and the bones were aching because calcium was not getting carried into the bones. So yeah, so things like that. Tummy aches again, if there is, I've seen that tummy aches are very, very con, closely related to not having a good gut health, and constipation is the commonest reason for tummy aches. So if you were to ask me, uh, besides nutrition and anything else that parents should take care of, is I think they should consider the emotional health of a child also. That's very important as well. And some of these stories get cooked up because there is an emotional need, whether there's a tummy ache or a headache. There could be an emotional need somewhere. So parents should keep the channels of communication open. Sometimes we think they're kids and we really don't really have to spend so much of time. They're given food and they're given some entertainment, we're done. But children need definitely much more than that. And I would say, in spite of the fact we are very busy parents, we should at least make an hour for them every day. And that's how the bonding happens. That's how the communication happens. And that's how your kids would be able to narrate their experiences with you, which is a very important part of raising a child.
That's very good advice. I really like that.
Thank you.
One of the things that and I feel like I'm consulting you about my kids, but I will. One of the things that I believe, whether it's for adults or for children, is very important, is actually sleep. Right, adults need 7 to 8 hours, and kids are supposed to actually need more sleep. What's your recommendation on that?
Again, I think sleep was always considered as being people being lazy, right? I mean, even till about 5 years ago, I thought sleep was overrated and was just a waste of time, that we were sleeping too much. I think we've been raised to say, okay, why are you sleeping so much?
It was
Wake
a
up,
cultural
right?
thing.
Yeah, and suddenly now, like, sleep has taken a completely different role, and it is the top priority, even before nutrition and exercise now. So for, of course, adults, 7 to 8 hours. But in children, again, like nutrition, sleep varies for different ages. In a toddler, you could, in a newborn baby, it could be 12 to 16 hours. In a toddler, it could be 12 hours. And older children from onwards for 5 years, it could be anything between 9 to 12 hours. But an older child, which is 10 years and above, definitely need over 9 hours of sleep.
Till what age? Till,
Till about adolescence. You would see adolescents sleep a lot. That's because they grow when they sleep. they're actually gaining their height and everything when they're sleeping. So adolescents sleep a lot. That's why adolescents can even have 9 to 10 hours of sleep. So when I say adolescents till about 18 is okay to have, which is very sad because they're all struggling now to, sit for exams of 11th and 12th grade, and they lose up on sleep, and that's why they catch up on their sleep on weekends because their body needs it. So they actually need more than 8 hours of sleep
Okay.
because
Wow.
of the growth that's going on.
One last piece that we hear about, and this touches a little bit about on the allergy thing also, right? We see there's this saying, "Oh, let kids play in the dirt," right? But it's very hard for us as parents to like allow that. What's your advice on balancing hygiene versus like exposure to like
I think we should let them play in the dirt. Yeah, for sure. When I say dirt, I'm not saying that they're going into really dirty waters and stuff like that, but like sand pits, going to in the field, picking on grass, feeling different things. It just again, one is touch and feel and smell and everything, and then the cognition improves as well. And of course, I guess somewhere the body just is in contact with the nature and it thrives. So you should let
that?
the kids play in the dirt. But I'm not saying dirty, dirty dirt, as in like dirty waters of the sewage or something like that. But yes, outdoors,
Exposure to
farms.
nature.
Yes,
Right.
be more in nature.
Yeah. No, that's I think that makes a lot of sense, and that I think a couple of points that you touched upon there, including the emotional connection with kids, spending time with them, just listening to them, and that sugar association was quite a relevant point.
What I did not really touch upon was the digital use. That's a different ball game altogether, and more and more studies are showing that the use of screens are actually rewiring how they have started to think, and it's leading to a lot of depressions and anxiety issues. The screen, there apparently it causes too much of a dopamine stimulation, and then there's a crash in that stimulation, and so there's a literally rewiring of the brain that's happening with overuse of the digital media.
But in this world, as
You
just
have to,
touching upon
right?
this
I know
point, right?
that.
Like, how do you like? There are schools which recommend that you log on online
Yes.
to do some project work. You do need to do research, right? I mean, if we were to take that one step further, if we think about screen time, is there something? Is it more that short duration, like dopamine hits of like, let's say, YouTube shorts, or like social media and some of these things? Is that what is the problem, or is it just generally screen exposure that causes an issue?
So, what's going on right now is, of course, that they learn a lot from this media. Okay, we all learn a lot from it, but it's not getting regulated. So besides the curriculum that we talk about children, they have to do, then they move on to YouTube, or whether they go to TikTok, or whether they go to other social media. So it just becomes like a spiral. I think as parents, we still have to play a role by saying that your outdoor is important. Your meeting other people is important. Um, I mean, I do give recommendations of playing for an hour every day, okay, which is important. There should be no compromise on that. And smaller modules, well, like using your screen for about 30 minutes and then take a break. So the smaller modules of 30 minutes probably doesn't give so much of repercussions, or their downsides are lesser. But there are some things which cannot be compromised on, which is human connection, making friends, real friends, human friends, touch and feel friends, and not online friends, and play outdoors. is very, very important.
True.
Up until 18. After 18, well, all the best to the parents.
Yeah, I think that's good advice for adults also,
Yeah.
to go out and play for some time, as well as maintain some human connections.
Yeah. So
Uh,
I always feel like we eat every day. We have a regimen for eating. So we should have a regimen for, I wouldn't say workout, but a physical activity, movement. We should have a regimen. We eat, we bathe every single day. So why do not incorporate movement, exercise every single day? You would not probably deal with issues later. I
yeah,
always say how you live today is going to show you maybe 30 years from now. So live a balanced life. Get all the stacks, sleep, exercise, nutrition, human connections right, and you won't have trouble later.
lovely. It was. I mean, this was a really insightful chat.
Thank you.
Really appreciate you coming on today. I can tell you, I learned a few things,
I'm
and
glad.
I'm glad to have you on this, and hopefully it was going to be really helpful for all the folks who are going to listen in as well.
I
Yeah.
hope it was of
Thank you,
use.
doctor.
Yeah,
Really
it
appreciate
was
this.
lovely being here. Lovely being here. Thank you.
All right. So we have this section called a rapid fire section, where it's basically stuff that we see on social media, and just want you to get your quick reactions on all of those, right? So, can certain foods, yogurt, bananas, milk, cause or worsen recurrent cold and coughs?
Yes and no. Yes, if you have some kind of irritation or an allergy to milk or eggs and things like that, it can worsen. But as a blanket cover, do not stop eating these foods because they are really good for you. For example, bananas, if you have a cough, can aggravate your cough because it has high histamine, but otherwise, no.
Got it. I get cough so often. Should I get a food allergy test done?
So that's what I hear very often. Every cough and cold is associated with food, but that's not the case. We have to remember that sometimes it's viruses which causes colds and coughs, and secondly, it could be aeroallergens, your molds and your pollens, and it necessarily is not the food. So food is not always the culprit as it's thought to be.
Is overdiagnosis of allergies a real thing? Are we becoming too cautious?
I hear that a lot, yes. People think that everything that is happening to them is because of food that they ate. So if they have, for example, swelling of the face, they think that they ate a particular food that caused it, or they had itching, or they think a food that caused it. So I would say a food allergy is overly, I wouldn't even say diagnosed, it's self-diagnosed, and that's not the case. I again say that allergy means intense reaction, which means that you would flare up. It's not like a little intolerance where you will have bloating, diarrhea. That's not an allergy. That is just maybe sensitivity or intolerance. So we need to make these discerning
Distinction.
distinctions. Yes.
Yeah, that makes sense. Can breathing techniques like the Wim Hof method help you manage allergies or improve immunity?
It can help you in generally improve your lung capacity, may be helpful for asthmatics, but um, I don't, I can't comment on the fact that that method can actually remove allergies altogether because they come in many forms, like we discussed. It could be the gut, it could be the skin, it could be the nasal passage or the lungs. So lungs may benefit, but maybe the rest of the organs not.
Got it. Pineapples contain an enzyme called bromelain, right, which is supposed to be a natural antihistamine. Uh, does this help with allergies?
Okay. When I started to run, I read that bromelain or pineapples should be used as an anti-inflammatory for aches and pains. And I did not realize at that time it was an antihistamine. So I would say because it is an anti-inflammatory, maybe it would have a benefit, but there's a warning there. You could be allergic to pineapple. So not necessarily, but more than allergic to pineapple, you may see that sometimes when you eat pineapple, you get a little itching in your throat and your ears, which may mean that you are allergic to grass pollens.
Wow.
So yeah.
Okay. All right. Thank you so much.
You're welcome.
Hope you guys enjoyed the podcast. If you like it, comment, subscribe, tell your friends about it. And if there are any topics that you want us to cover, just add it in the comments and we'll make sure we'll cover them in the future.